Cardiovascular disease is a lifelong process that starts in childhood, progresses slowly and can affect people at all stages of life. The good news is a healthy lifestyle is helpful at any age. Your heart is a muscle that pumps the blood around the body. Like all muscles, the heart has its own blood supply, which comes from the coronary arteries. As we grow older, these arteries can narrow and inflammation and damage can occur. Bad cholesterol, the LDL, gets taken up into the artery wall, causing fatty plaque buildup, which narrows the arteries, reducing the blood flow, leading to a reduction in the supply of oxygen to the heart muscle. The inflamed vessel may ulcerate, forming cracks on the inside of the artery wall. Blood sticks to these and can form clots, narrowing or blocking the artery. The narrowing can then result in a cramp-like pain around the chest. This is called angina. The reduction in blood supply may be more noticeable when the heart has to pump harder. For example, when someone is walking up a hill or rushing, the heart is working harder and demanding more oxygen for the muscle. Increased demand and reduced supply often leads to attacks of angina. If the plaque ruptures, platelets, which form blood clots, collect at the site to try and cover the plaque rupture. This blood clot can block the coronary artery so there is less blood or no blood getting through to the heart muscle. This is called a myocardial infarction or a heart attack. The good news is that if the blockage is opened up very quickly, the heart can fully recover. There are many medical and surgical treatments available to prevent this happening in the first place and to treat if it does happen. You can do a lot too by leading a healthy lifestyle, taking plenty of exercise, stopping smoking, limiting alcohol, lowering salt, sugar and fat in your diet, and take all the medications that you are prescribed. Similarly, the narrowing up or blocking of your arteries in the brain may result in a stroke or a mini-stroke called a TIA or transient ischemic attack. Narrowing of the arteries to the legs is called PAD or PVD. That's peripheral arterial disease or peripheral vascular disease. This presents as a cramp-like pain in the calf, thigh or buttock. Cardiovascular disease can also include other types of heart problems such as valve disease, irregular or abnormal heart rhythms, or a weak heart muscle, leading to heart failure. The valves in the heart allow blood to flow from one chamber to the next and allow for the ejection of blood from the heart. These valves may become damaged due to a variety of causes and may narrow, restricting the blood supply flowing through them. This is called a stenosis. The valves may also become incompetent, not shut properly, allowing the backflow of blood or regurgitation. If the valve is severely damaged, it will require surgical repair or replacement with a tissue or metallic valve. If you have atrial fibrillation, often called AF, you're not alone. This is the most common type of arrhythmia or irregular heartbeat. Atrial fibrillation occurs when the upper chambers of the heart, the atria, have a completely irregular heartbeat. This fast and irregular rhythm means the atrium doesn't eject blood efficiently and blood may pool, forming a clot. This clot may travel to the brain and block an artery, causing a stroke. Someone with AF is 5 times more likely to have a stroke than someone without this condition. Detection and ongoing management of atrial fibrillation is vital to reduce the risk of stroke. AF is usually treated with medication and lifestyle changes. Most people with AF will have medication to control the heart rate and will be prescribed a blood thinner to reduce their risk of stroke. Non-surgical and surgical treatment options may also be considered to restore the heart to a regular rhythm. During cardiac rehabilitation program, you'll receive more information about this condition and how to manage it. Heart failure means your heart is not pumping as well as it should. This can lead to symptoms such as fluid building up in the body, causing swelling of the legs, or in the lungs, causing shortness of breath. Combined with fatigue, These symptoms can make everyday activities more difficult. Weight gain is a key sign of fluid buildup, so it's important to weigh yourself every day. Noticing a weight gain and reporting it is one of a number of important self-management skills that can help you get better and help avoid admission to hospital.